Hello, my name is Daniel Torrado, and I will be presenting today a case report about the complications during treatment of B-cell acute lymphoblastic leukemia in an adult patient. B-cell acute lymphoblastic leukemia, also known as B-ALL, presents a bimodal distribution. 80% occurs in infants, with the first peak in childhood. ALL represents the second most common cause of acute leukemia in adults, with the second peak around 60 years old. Clinical presentation is diverse, including symptoms like fatigue, infections, bleeding, bone pain, hepatosplenomegaly, neuropathy, and constitutional symptoms like fever. Despite appropriate treatment, this disease is remarkable for its complexity and associated complications during treatment. We report a case of a B cell acute lymphoblastic leukemia with a non-specific presentation that was complicated with severe pulmonary infections and gram-negative bacteremia. Our case is a 74 Caucasian male that presented with a 7-day history of diffuse, sharp, right-sided chest and abdominal pain. On examination, he was found to be hypertensive with tenderness to palpation on the right lower quadrant. Patient was subsequently found to have de novo neutropenia and lymphocytopenia with 20% blast and elevation of serum creatinine and transaminases. Hepatitis panel was negative and abdominal ultrasound was unremarkable. Flow cytometry, chromosome analysis, fluorescence in situ hybridization, also known as FISH, and bone marrow biopsy revealed a CD20 negative, CD22 positive, CD19 positive, Philadelphia chromosome negative B cell acute lymphoblastic leukemia. Patient was started on chemotherapy on 3 phases. In addition, intrathecal methotrexate was used for central nervous system prophylaxis. The hospital course was complicated with neutropenic fever and multiple opportunistic infections including Streptococcus viridans, E. coli bacteremia, Mycobacterium avium complex, and pulmonary aspergillosis after induction therapy. Despite appropriate treatment with antimicrobial therapy and interval improvement of pulmonary lesions on CT scan of the chest, the patient developed respiratory failure requiring intubation and was transferred to the intensive care unit. B-cell ALL is a malignant transformation of B-cell progenitors. The disease progression is characterized by the invasion of the bone marrow and extramedullary sites by lymphoblasts. The accumulation of neoplastic cells on any given organ system accounts for the vast diversity of clinical presentation seen on this disease. The expression of specific surface antigens and the detection of the Philadelphia chromosome make possible the differentiation in the cells involved, in addition to a better tailoring of the chemotherapy. The management of adult BALL is often challenging due to the complexity of the treatment and the increased risk of opportunistic infections secondary to blunting the immune system. Information regarding infection-related complications in adults with ALL is lacking, and most of the data available discuss these complications in the pediatric population. The prognosis in older patients is usually poor and is characterized by shorter remission duration and overall survival as the presentation age increases. With the use of modern chemotherapy agents, 50 to 90% of newly diagnosed patients will achieve complete remission, but 30 to 60% of them will relapse. Only 25 to 40% will survive 3 years. Meticulous examination and prompt identification of infection-related complications can improve the overall prognosis of these patients. Thank you for listening.